I'm an adolescent medicine specialist and a pediatrician at Children's Memorial Hospital, and I'm the medical director of a school-based health center in Uptown called Uplift Community High School. I'm speaking today from my experiences on behalf of the Illinois chapter of the American Academy of Pediatrics, representing 2,300 pediatricians in this state, with a primary activity of advocacy and projects to improve health and well-being of Illinois children. The ICAAP is addressing childhood obesity crisis through a campaign called Promoting Health Initiatives, which is funded by the Sprague Foundation. Primary care providers really don't have the time or the resources to address the complex problems of obesity in their offices without help. I think we know our patients and they trust us and we want to work on this, but we need to have the support and help of other people in this room in order to do this. My work at Uplift School Health Center in Chicago Public School, I follow 6th through 12th graders. As my patients move through adolescence, their weight problems and risk of chronic illness often increases, sometimes exponentially during adolescence, from what this woman before me was saying, where they go to the stores and they buy junk and they're not getting, they're not choosing proper things in the lunch line. We identify 11-year-olds who are overweight, and by 16 they have hypertension, hyperlipidemia, and high insulin levels. They report eating no breakfast, pizza, nachos, and fries offered daily for lunch in the lunch line, and we try to work with them on empowering them to use their own behavior to change what they're eating. We use a SMART tool, which is a measurable, achievable, realistic, and time frame tool to help kids decide what they want to do to try to make a difference. But teens need our support and help in order to follow through on their ideas. And they have lots of them. And if we don't intervene, it will be an emergency. So it's now or later. Grant funding is increasingly difficult. We have mental health and nutritionists and things that we provide at our school-based health center, but primary care providers can't offer these things in their office. And they need reimbursement for these services. Medicaid does not reimburse private pediatricians, and we don't get the support we need. We need funding for screening for BMI and psychosocial evaluation, coordination of patient care, mental health and nutrition counseling. We make those recommendations that you would support us in trying to get reimbursement for these screenings, coordination of patient care, mental health counseling, and nutrition services. We found in our school-based health center, when we put these services in place for kids, that they were able to maintain their BMI throughout their adolescence. But without those supports, they can't get anywhere. Thank you so much for allowing us to speak and to have this conference. And we'd like to try to intervene before kids have chronic problems.